Thank you, Premier. So 177 new cases today, clearly lower than the maximum number that we've had on any one day. I think I've always been calm in these presses, but I have never been complacent. I'm not going to be complacent about today's number. It's great that it's lower than our peak, but it may not be our peak yet. So I would like to see a week of decreasing numbers before I come and say that I've got greater comfort about the direction we're going in. But as a reflection of the actions that people took a week or more ago, I think it probably is a good sign that this is exactly what happens when people are following the stay-at-home directions, isolating and testing appropriately and minimising their contact with others. This is exactly what we will see as people do the right thing, and it will continue to drive down if those behaviours are sustained. So that's a small bit of optimism in today's numbers. With respect to outbreaks, and again, you know, there are 4 or 5 new outbreaks every day. The numbers change significantly, and with close to 200 new cases, the linkages that happen over subsequent days always change those numbers. But I'm aware of 6 cases linked to La Mana supermarket in Essendon, 12 cases linked to Somerville Meats. That setting is closed. But these are cases that are subsequently cropping up in all of the staff who are in quarantine. 8 cases linked to Senvic Construction in Footscray. Riverina Apartments, they're called. 26 cases linked to Menarok Life Aged Care Facility in Essendon. That's a big aged care outbreak. A number of staff and a number of residents have become infected in that outbreak. But that's being very intensively managed at the moment, including transfer of some residents to acute care. 13 cases linked to Glendale Aged Care Facility in Werribee. 144 cases linked to the Al Taqwa College outbreak. And we've got 2 cases linked to Japara Central Park Aged Care in Windsor. So again, aged care not surprisingly represented in outbreaks. The vast majority of our aged care outbreaks have involved 1 or sometimes 2 staff and no residents. Again, that's a measure of staff identifying themselves as soon as they become unwell, and very extensive testing of residents and lockdown in those aged care facilities. But they are critically vulnerable, and we need to manage them as closely as we possibly can. Well, I might have something more specific. Yes, I understand that it's the cumulative figure. 28 are in staff, 76 are in students, 16 are close contacts who will be in the households of those staff or students. There are a further 22 under investigation.
So how many new cases today?
I don't know the number of new cases for today for Al Taqwa.
What's been done to prevent further cases in the Housing Commission towers, particularly those ones that weren't subject to the initial department?
Essentially, we're really trying to roll in a public health model of response in all of the other towers that involves a real focus on prevention. So that's hand hygiene, the alcohol-based hand rubs availability, the deep cleans, the multiple high-touch surface cleaning in those environments. But the really key element is making sure that we engage with the communities within those towers, allow them to test whenever they want to, with the mildest of symptoms, and support them in their isolation and the quarantine of their close contacts. There has been much more intensive inReach in some of the towers in Carlton, for example, where testing has really gone door to door to check in with community members to see whether anyone wants to be tested, and for a couple of towers that's included symptomatic and asymptomatic individuals, because when you've got significant numbers in a closed setting, then asymptomatic testing can be appropriate to pick up further cases. That tends not to be the case in general drive-through and community testing, but in very concentrated outbreaks, broad testing of symptomatic and asymptomatic people can be very useful, and that's happened in Carlton.
Was the department aware of some cases in those Carlton towers back in May? And I guess if so, should these interventions have started a bit earlier?
I'm not sure exactly when the first cases cropped up in Carlton, for example, but all of those individual cases get the support of isolation, quarantine and follow-up of close contacts.
Brett, we're seeing abattoirs, aged care staff, public housing towers as well. Is there a concern that this virus is hitting sort of communities with lower paid, less secure workers more than the rest of us?
Yeah, absolutely. We know that pandemics can really shine a light on social inequality and economic inequality. People who have more insecure work and are really obliged to come to work are obviously more likely to turn up with mild symptoms. So it is a challenge, and we have to reach into all of those community members in order to understand how best to support them for the things that we know that will work, the isolation and quarantine. I do want to say, it really is critically important not to come to work even with the mildest of symptoms. People who test positive and who require time off work in order to isolate or quarantine have the hardship payments available in Victoria. I hope that gets really broadly broadcast, because that's an important thing for everyone to understand, that you shouldn't feel obliged to come to a workplace with mild symptoms, and there are really significant consequences for outbreaks in some of those sensitive settings.
Can I just ask you on that issue? Sure. Is that something that I don't think may work, have to work isolation?
I might just go to contact tracing first, because I just want to make a point. The Special Advisory Group of experts in the UK suggested to the UK government that they'd be stretched if they had to follow up 50 new cases a week, and they should probably stop contact tracing when they got above 50 new cases a week. So I just want to flag that our team are doing gold work. They really are. We are following up every single new case. Now, between 1,000 and 1,500 new cases a week. It is an extraordinary volume of work, and they are following up every single case. We have not given up on contact tracing. On the issue of healthcare workers, look, there have been a very significant number who've been infected. That does relate to transmission from a week, 10 days ago. A lot of that is obviously contact with patients, sometimes with mild symptoms, sometimes even before symptoms have emerged. But healthcare workers are equipped with PPE. They need to make sure that they're wearing it across all settings within the hospital, including when they're interacting with other healthcare workers, even in social engagement in the broader areas of health settings. But it's a risky profession to be in the emergency department in ICU on any of the wards in hospitals where coronavirus patients occur, and so they need to be absolutely mindful of protecting themselves with PPE. Yeah, I'm aware of a case at the Royal Women's as well.
I have a couple of questions about some emerging outbreaks that we're hearing about. Monash Hospital Mental Health.
I'm aware of Monash Health cases as well. Again, I don't have all of the details as of this morning.
Okay, the Melbourne Clinic.
No, don't have it.
Okay, have you got anything on Mantra on Bell Street?
Yeah, so I'm aware of a case of Mantra. Obviously, it's a Commonwealth jurisdiction. I'm aware that one of the APOD workers there has tested positive, but had not been infectious while at work. Obviously, there are refugees held in that facility. They are a significantly vulnerable population, but my understanding is that there's been a significant clean of that facility, and that the worker who's been identified hasn't been infectious at the workplace.
How useful has the COVID Safe app?
As I've said before, the COVID Safe app is a very useful tool when we've got a lot of people moving about who might be standing next to strangers, people they're not familiar with, for more than 15 minutes or 2 hours in the same room. The Bluetooth handshake that occurs between phones where the app's been downloaded captures anyone who's been within that 1.5 metres for more than 15 minutes. In Victoria at the moment, with stage 3 restrictions, we're not going to have many people who are standing next to a stranger for more than 15 minutes because people are staying at home.
In terms of before the lockdown, with this outbreak, with our spike, how useful has it been in tracing these people?
Well, we haven't found a number of additional contacts with the COVID Safe app, but if you take the pub outbreak in New South Wales with 600 people who were there for the night, that's exactly the kind of setting where you would hope that the COVID Safe app has been downloaded by a significant number of people, because they will not be known to each other, and that Bluetooth handshake will flag some interactions where someone might be notified automatically by SMS if that linkage has been made.
Metarock,
Aged care.
aged care, 26 you said, have you ever break down on residents and staff, and does that now make it the biggest cluster in an aged care? And you were talking the other day about the success that we've had spot fires, but no major clusters, so you're worried about it?
I am worried about it. I think it's a reasonably even split between staff and residents who've been infected at Metarock. But again, I'd have to go to the detailed report in the Chief Health Officer media release this afternoon. It is a concern. I think we're still having success in as much as the vast majority of our aged care cases have been single staff members, or sometimes multiple staff members without residents becoming infected, but they are all at risk settings. And we need to be really mindful of doing rapid lockdowns. The outbreak squads go out on the same day and they do very broad testing of all the residents to identify cases early.
Are those
Is this the
residents
biggest one?
presenting to hospital?
This is the biggest one in aged care in Victoria to date, yes.
Are those residents staying to present to hospital now?
Some of them have been transferred to hospital for their care. Obviously, that's both because they are at risk of very significant consequences, but also because it helps to manage the outbreak in those settings.
Are any of those in the 17 ICU?
I don't know.
Are you aware of a cluster involving a party on the airport list?
No, I'm not.
And just on Altaqua, I think the whole school community was sent into quarantine on the 3rd of July. That would mean that for those who haven't gone on to test positive, they'd be able to be released on Thursday from quarantine. How quickly after Thursday will you be looking at that school returning, given that we have now 142 cases left?
Yeah, so for Altaqua College, clearly for those who went into quarantine more than 14 days ago, they have an entitlement and they are safe to return. But there will be family outbreaks where close contacts have become positive, where their quarantine period is basically extended. When you have a new positive case, you've been re-exposed to coronavirus as a close contact, then as a student, your quarantine period only ends 14 days after you have been isolated from an infectious individual. So not all students will have an entitlement to return, but I think the great majority will have gone through the quarantine period.
Brett, is it time to switch the strategy and move to an elimination position in Australia?
Look, I think we'd all love the elimination option to be available to us at the right time. Today is probably not the time to talk about it. We absolutely have to get to the other side of the curve and have it suppressed sufficiently that elimination is even something that we can talk about. You have to get to a point where you're down to single digits and days of zero before you can meaningfully talk about elimination, and we are not there yet.
Professor McGorry, just what this is going to do, and I guess how people will be coping.
Just back to that with people not changing it frequently enough. Some medical professionals say it won't only be useless but actually be counterproductive. Do you have concerns about that?
Not generally. I think for individuals, yes, you can use a face mask in a way that makes it more dangerous. But the Lancet meta-analysis that has really changed our view on masks and been pretty clear is that in general use, with all of the imperfections about how people understand them, with people sometimes wearing them over their mouth and not their nose, or not tightly enough against their face, with all of those imperfections in behaviours, it still limits transmission quite significantly. And it does it for a couple of reasons. One is because even imperfect use will limit some of that transmission, but also it seems that people stand further away from us when we're wearing a mask, which is a double protection for us. So I think, the Lancet view was that overall, close to universal mask usage is a really significant driver down of transmission. So I think, I would just give it the thumbs up, make it a recommendation for anyone in our Melbourne and Mitchell Shire areas, and a consideration for anyone outside of that if they're vulnerable, if they're going into a setting where they're concerned.
Have we had anyone in Victoria get coronavirus
Yeah, I'm aware of a case in the US who appears to have gotten it twice, certainly not in Victoria that we're aware of. There might be some persistence of finding virus in some people where they actually haven't got it twice, it's just been reactivated or it's been detected and it's essentially dead virus, but I'm not aware of anyone contracting it twice. Thank you.
Any other issues for us? If not, we'll leave.